behalf of the Treaty 2 government and Grand Chief Eugene Eastman, Bonjour, Kinawia, Nijoganiduk, Shigundine, Maganiduk. Aho! If you're watching us this evening and you'd like to join us as an interviewee, me magiteje inabi kebinan. You can join me live on this link at https://app BeLive .tv/628-441/guest. Aho. Just listened to the provincial update here in the province of Manitoba. And they gave us a COVID update. Dr. Brent Grusin, the Premier, Mr. Brian Pallister. And from what I understand from the update, specifically the update, is this. News agency this morning is reporting that the Premier of Manitoba is reporting this afternoon that 900 doses will be made available to Indigenous in the North. 900 minikugai doses. That's 2 doses. So that's for 900 people, that's 1,800 doses. And it'll be from the Moderna pharmaceutical company. So Moderna will be providing 900 doses to Indigenous in the North. Well, they'll be providing it to the province of Manitoba, and then from there, the province will actually, I think it'll be provided federally. But I'm just communicating the information to the best way I can, to the best of my knowledge. So Moderna, that's those are the ones that doesn't require extreme refrigeration, like that minus 80 with dry ice and all of those very cold refrigerators. Right now, immunization clinics are being coordinated. They're being set up. And the first immunization clinic will be set up sometime next week. That's what they're saying on the news. Today's press conference. And initial doses here in Winnipeg, Winnipeg. Here in Winnipeg, healthcare workers are a priority. There's 4 units, and they will be giving initial doses for 900 people. That's healthcare workers. Healthcare workers. We meaning as what immunizations, and what we've found out today is that 238,600 doses. 238,600 doses will be sent to Manitoba by March 2021. So all the doses and it'll take until March 2021. It's going to be a long process. It's going to be a long process, but they want to focus on health center on the healthcare workers first. Indigenous, our elderly, elders, we know nigan the meaning that vaccine. So in the North, mi maga gitatis yot anishni chanishnave benanik umashkiguk mi mata un gemini azwak a priority for vaccination. Oh, yeah. There are plans to expand and to make more sites. Immunization clinics. We They're going to be making immunization clinics and setting them up, and they have plans to expand and create more throughout the province of Manitoba. So I watched the news, the press conference there with Dr. Brent Rosen and the Premier of Manitoba, uh, Mr. Brian Pallister. They talked about today's numbers. Noongum wega abitoy sick this day on Wednesday, December the 9th, 2020. Ki nagatakyo kanant mino. Ki machauk anant mino. Yo tapenegwa mino yeah. Opanea cuisine, the lung sickness. Mie manitu shop piniwin, the bug sickness. Mie COVID-19 windaman. Manitu shop piniwin gema opanea cuisine. 18 deaths. Noongum kitipachimuk. 18. Gabe on nagatakyuk. Gabe machauk. Ango music ni chanishnabe mak ango music te bacha wadawa and it's a serious thing. When at way I wanna attack you. Na negachi chib must say you have to be very careful in your steps, in your daily steps. Ishpin maish, come on. If you go shopping somewhere in Saint Rose, Emma, if you go shopping in Swan River, Emma, in Brandon, Emma, Ashern, if you go shopping somewhere, when wherever you are, wherever you end up, my condolences to you. There has been a test positivity rate of 13.5% in Manitoba, and it's higher in Winnipeg. It's 14.5%. Winnipeg. Shigoi, there's 285 cases today. 285. Kega nisok. Kega nisok. Ayawag. Kega nisok utano akuzin. Upjo ingang womizik, stay safe wherever you are. It's important. And while the vaccines are not here yet, next week at the end of next week, there'll be vaccines here next week. At the end of next week, make it on the province of Manitoba press conference. Ashko no madaman. Aige. 285 cases today. We can do better. We can help one another. Nina went. Tawi I want to offer some advice in a constructive way. Do you know what to do if you're sick? Contact a health professional right away before you start any self-treatment. Do you know where and how to get treatment? Do you know where to go? Make sure you start thinking about stuff like that. It's going to be snowing here in Winnipeg tonight. 4 centimeters is predicted to fall over the course of the evening up till tomorrow. So with that, I want you to take care of your emotional health. Help yourself to think clearly and react to the urgent needs to protect yourself and your family. And take breaks from watching, reading, or listening to news stories, including those on social media, and hearing about the pandemic repeatedly. It can be upsetting. And I apologize, but again, I'm being very mindful of people who need to hear this afternoon. Take care of your body. Take deep breaths and stretch. Try and eat regularly and in a healthy way and with balanced meals. Try and exercise regularly, whether that means going for a walk, walking up the steps in your apartment, walking around the backyard, walking the perimeter of the fence or the perimeter of the trees. And then get plenty of sleep, 7 hours or more. That's what constitutes a good night's rest. And avoid excessive alcohol and drug use. Make time to unwind. Try to do some other activities that you enjoy. Make some time. Maybe you want to have a bonfire. Maybe you want to do something out in the garage or something. Maybe you want to work on the skidoo. Here we go. Here we go. Something to help you get through the day, the evening. And it's important to connect with others. Talk with people you trust about your concerns and how you're feeling. And connect with your nation or your faith-based organization. While social distancing measures are in place, consider connecting online through social media or by phone or mail. You could do something like that. So once again, 285 new cases have been announced. 285 cases on Wednesday. Wednesday announced. Wait for that to populate, to go into the system, and then announce it. 285 cases on Wednesday announced. 285 cases on Wednesday announced. Angomesic, stay safe. Angomesic, stay safe. Stay safe. Hit it. Yeah, non de kito anwam nan ungum. Stay safe. Wherever you are, stay safe. Aham. Neto kuminikwi kito anuman ungum. Just long enough to tell you the COVID update, long enough to tell you the amount of vaccinations that have been that are being scheduled and planned, and long enough to tell you the test positivity rate, as well as how many more doses are coming to Manitoba. Coming to Manitoba by March 2021. There are going to be so much more that we can do and we will do for our people. We have to stay safe wherever we are. Wherever we are this afternoon. Stay home. Only go out for essentials and stay within your region. And this is not the time to be hosting gatherings. Limit your household to those who live there. And most nations are now restricting access for no visitors at this time. On their borders. All nations are closing their borders now to stay safe. And in a hopeful way, we'll all be able to come together again soon. We just need to be patient and follow COVID measures. And a vaccine, as you've heard, is already on its way. What you could be doing in the meantime, and tonight and every night, is phone your elders. Check on your elders. And visit on the phone. I'm sure that would be such a nice thing to receive a phone call from someone asking me how I'm doing. And if you're missing family, why not FaceTime or video message them, or even write an old-fashioned good letter on a Christmas card. I've said that before, and I say it again. That's a really genuine way to connect with family too. And if you go out, Tinayama ganito. Keep 6 feet distance. Wear a mask and wash your hands. So with that, keep safe. We're not stuck at home. We're safe at home. I want to thank you for tuning in to Mountain Trail News, our afternoon program, Health and Wellness, our health and wellness program. And with that, Higai, I send my condolences to everyone nagatakyot at this hour. Thank you, Kinawiya. Miigwech, thank you for your support, and thank you for this honor to be the one who brings the news to you. Aho. I'm Corey Whitford. We'll see you at 6 p.m. Nichagan. Uh, TP Talks. We'll be doing TP Talks. Okay, so Mino 6 p.m. Migaob min. Aho. Ang gomizin. See you soon.